Hi, this is Dr. Padda. I wanted to discuss a little bit about the interpretation that we give to things. And I think that it's really important because a lot of times patients come in and they have a particular event that's happened in their life and they interpret that going forwards, and it seriously impacts their current events. And a lot of times I spend time with patients trying to explain that your past, your present, and your future, your timelines, have a very significant impact on your current perception. And sometimes this gets lost in translation. So I thought I'd spend a few minutes just discussing trauma and pain and understanding it through the lens of time. How you frame things, how you look at things, determines your perception of the current. And your perception of the current will then decide your future. The present moment is really just you determining what your story of the past was. And that present moment will also determine your future. I know this sounds hokey, but I've dealt with a lot of situations, personally and with my patients, in which patients and me personally have had significant traumatic events in childhood, have had issues that almost seem overwhelming or just out of control, such to the point where you can't really move forward. If you constantly dwell on that as a tremendous negative thing, and that impacts how you perceive you are today, and how you are today is determined also by how you think you will be tomorrow, then today will be miserable. So the concept of positive psychology means that in order to have an increasing better past and an increasing better future, you have to reframe it. And if you can do that, if you can get to the reframing concept, you'll do a lot better. The present causes the meaning of the past. So how you're thinking about it today really determines what happened in the past. We are reinventing our past continuously. Our memories are basically quantum pieces of information that we're interpreting, and that interpretation is based upon where our emotional status is today. I know that sounds hokey. I know that a lot of people will go, well, but that happened. And I recognize that that happened. But your interpretation of why it happened, what happened, and did it benefit you in some way, or did it harm you? And even if it harmed you, did it benefit you? The thing is that things happen for us. They don't happen to us. There's a lot of times that we look at things and go, oh, that just happened to me. It was a terrible thing. And for that reason, the rest of my life will be miserable. Well, everything has a lesson. Everything has a purpose. And we each have a purpose and a destiny to fulfill. And how we interpret that destiny and how we interpret that fulfillment determines how we perceive things today. I often tell patients that when we use pain medication, we have to be very careful, because pain medication releases a compound called dopamine. Dopamine is a motivational neurotransmitter in our brain, and it gives us the sense of pleasure. And sometimes when we believe that our past is horrendous, we use dopamine like substances, like narcotics, to wrap ourselves and shelter ourselves from that past trauma. And I recognize that that can be a big deal, but the goal of therapy when we're trying to get patients going from point A to point B to point C and into the future is to deal with those pasts, change our perception of that past, and look for a brighter future. Our present is determined by how we interpreted the past and the brightness of our future. If you believe that who you are in the present is based on what happened in the past, then you're letting the past dictate who you are in the present. And we can reinvent that. Using the past as an excuse or a reason for what's happening in the present is wrong. What you want to do is you want to look at your future and then reinterpret the past and ask yourself, how does the future look if I reinterpret the past And if you do that, your present will also get better. I know this sounds hokey, but this is how psychology works. And time is not linear. Time doesn't go from past, present, and future in our brains. It certainly may be linear as in terms of our ability to go back in physical time, but the perception of time in our brain is nonlinear, and we can affect that perception and the events around that perception by reframing and looking at it through the lens of time. I know that a lot of patients will have a struggle with this, but I encourage you to talk to me about this so that we can have further discussion, so that we can look at this together and see what we can do to affect the interpretation. And if we can affect the interpretation, the perception of your current pain will change, and the use of medications will change, and your brighter future can hopefully become more evident.